Greetings to whoever that's watching this video. My name is Ruth Barrow. I'm a public health nurse. Over decades, HIV slowly spreads across Africa and other parts of the Western world. The history of HIV can, however, be traced far back in the late 1800s. In today's video, we shall be looking at what HIV/AIDS is. We shall also look at how is it transmitted. What are some of the predisposing factors or the risky behaviors that exposes someone to getting HIV? Are there interventions for persons living with HIV? And how do we limit or reduce the risk of acquiring HIV? First of all, HIV is a virus that attacks the human body's immune system, and it stands for Human Immunodeficiency Virus. It can also be classified as a sexually transmitted infection. HIV can only be transmitted through certain body fluids such as semen, vaginal fluids, breast milk, blood. But for transmission to occur, these fluids have to come in contact with a damaged body tissue or a mucous membrane, or from a needle or a syringe of a person infected with the HIV. Remember that the mucous membrane can also be found in the vagina. It can be found in the penis and also in the mouth. Now, what are some of the risky behaviors that predispose someone into getting HIV? Remember, persons who engage in unhealthy or risky sexual behaviors, like having anal sex or vaginal sex without the use of a condom, are at risk. Sharing needles, syringes, or other injection equipment are also at risk of acquiring HIV. Certain cultural and social factors also play a part in HIV risks. Example, persons, poverty, lack of access to health facilities, stigma, social and other gender discrimination issues can predispose someone to getting HIV. Transgender women, that is women, people who have unprotected sex with men, can equally be at risk of acquiring HIV. Persons with multiple sexual partners are exposed. People who are fond of injecting drugs into their system are equally at risk. An HIV/AIDS mother, pregnant mother, is exposed to an HIV/AIDS mother can also transfer or transmit the infection to the unborn child. So the baby is at risk. Then we also have people who are already having STIs, sexually transmitted infections, or sexually transmitted diseases, are equally at risk. Now, what are the symptoms of HIV? Many experience flu-like symptoms within 2 to 4 weeks after the infection, which may last for a few days and several weeks. But remember that these symptoms can vary from person to person. Now, we have stages of HIV. We have the acute stage, and in this stage, people have large amounts of HIV in their blood and are contagious, and they can even transmit the infection to non-infectious people. The second stage is the asymptomatic stage or the latent stage. In this stage, it means you actually don't show signs and symptoms, but the virus in your blood tends to increase. The viral load starts increasing. And at this stage, if interventions are not put in place, interventions like taking the antiretroviral drugs, then you can develop the HIV/AIDS, which is the third stage. And this third stage is the dangerous stage, because the moment the infection leads to the disease, which is the AIDS, acquired immunodeficiency syndrome, then it becomes serious. And remember, at this stage, already your immune system is compromised. So it exposes you to other opportunistic infections, which can make you very, very sick. Now, when someone gets HIV, what are some of the interventions available? Interestingly, over the years, there have been antiretroviral therapies, that's the ARTs, which are recommended for persons living with HIV. ARTs are actually very effective in reducing the amount of viral load in your blood. It will interest you to know that if ARTs are taken as prescribed, it can make your viral load so low to the extent that it can not even be detected when you go through the test. Which means that if you take your antiretroviral therapies correctly as prescribed by your healthcare provider, you stand the risk of not transferring the or transmitting the infection to an uninfectious person. And that is how come it is possible for an HIV/AIDS partner to have unprotected sex with a non-HIV partner, but then there is no possibility of transmitting the infection, because at that stage the other partner who has constantly been on the antiretroviral therapy or antiretroviral drugs have very low chances of transmitting the virus. And that is why it is also possible that an HIV/AIDS mother can deliver a healthy baby without HIV, because if this mother during pregnancy or over a period of time, during the time she acquired the infection, takes the antiretroviral therapy very seriously, that will reduce the viral load, and in that essence it will prevent transmission during birth to this unborn child. Now, how do we prevent these risky behaviors or exposures to acquiring this infection? First of all, we need to know our status. Everyone needs to get tested and know your HIV/AIDS status. We also need, as people, we also need to avoid sharing needles or syringes or other sharps equipment. We also need to use condoms, or as partners, use condom anytime you are not sure of your partner's status to prevent the transmission from occurring. We should also make routine checks, just as we do routine checks for other diseases. We should also add HIV tests to our routine checks, and I would recommend that we should at least check our HIV status every 3 to 6 months, because mind you, unlike other diseases or infections that have vaccinations that you can take to prevent acquiring the infection, HIV/AIDS does not have a vaccination. So if you check today and you are free and you are still living a risky behavior, it means you are still exposed. You can get the infection in future. So let's develop the habit of routinely testing for HIV. Make sure you test together with your family so that you can be sure you are safe. Also, as a way of reducing the risk, we should report to any health facility anytime we feel exposed to HIV, so that they can early test and put us on the prophylaxis to prevent us from developing from stage 1 to stage 2 and even to the deadly stage, which is the AIDS stage. Also, as health workers, we should start the post-exposure prophylaxis anytime we feel exposed to HIV to prevent us from getting the infection. So I want to encourage you who is watching this video that getting HIV doesn't make it an end to your life. It is possible to get the prophylaxis and reduce the risk of developing AIDS. We have so many healthy people walking about who have the infection, but because of the antiretroviral therapies that they are currently put on, it reduces their risk of developing the AIDS. It is possible to get treatment for HIV so you don't develop AIDS, which is very deadly. I remain your public health nurse. Thank you for watching this video. I hope to see you another time. Bye.